Hi! Welcome to Doc Martin's YouTube channel. Today, I will be talking about one of the more common problems of the head and neck that we see very often in our intercare clinics, and that is temporomandibular joint problems, or simply put, the TMJ. There's quite a lot of material to cover, so I will be separating it into two videos. This week will be about massage techniques, and next week's video will be more about exercises that you can do for your jaw. The TMJ is the joint that connects your mandible or lower jaw to the skull, and it can be found on both sides of your head in front of the ears. It allows your jaw to open and close, enabling you to speak and to eat. Anyone who has ever suffered from jaw problems will share with you it can make your life miserable. Over our 27 years of practice, I have seen this quite often, so it does happen quite frequently. Studies estimate the lifetime prevalence of TMJ joint and muscle disorders to be somewhere in between 5 to 12%. One of my brothers even developed a severe case of TMJ dysfunction, which forced him to liquefy his food just to nourish himself, taking all the enjoyment out of eating, and also gave him difficulty engaging in conversations. As in everything in life, an ounce of prevention is worth a pound of cure. So let me share with you some of my favorite preventative strategies for mitigating TMJ problems. So let's get cracking! The TMJ is a joint which is formed by the lower jaw as it connects to the skull on both the left and right side, directly in front of your ears. Like most joints in the body, it has a small articular disc that helps cushion forces that build up in the joint with movement. It also relies on several muscles that help support the joint and guide the movement of the jaw. The main muscles that support the jaw are called the masseters, the temporalis, the lateral and medial pterygoids. Collectively, when the resting muscle tone, flexibility, strength, and nerve supply of these muscles are optimum, the joint functions normally, allowing us to speak and eat with ease. Opening the mouth is a function of the lateral and medial pterygoids relaxing, allowing the jaw to drop open. And closing your mouth is a function of a contraction of the masseters and temporalis muscle. Any asymmetry in muscle tone or faulty joint mechanics brought about by faulty nerve tone can result in TMJ dysfunction over time. This asymmetry can even change the shape of your face. Imagine when one side is fastened, it alters the shape of your face. So, let me show you my favorite tips for preventing TMJ dysfunction. Let me show you how to gently massage out the muscles of your jaw. Step 1, gently bite down, okay, and feel the muscles contract underneath your fingertips. This is where you're going to be doing your movement. Okay. Step 2, use the tips of your fingers, 3 or 4 fingers, and gently massage your muscles longitudinally downward this way. Think of ironing out wrinkles from your clothes, just up and down. Running the fingers 5 to 10 times, then across another 5 to 10 times. So the two movements are up and down and across this way. The area here is the masseter, the area here is the temporalis. Now, step 3, using 3 or 4 of your knuckles, make circular movements and massage the same muscles 5 to 10 times. Here and here. This feels really good and can relax, especially when you have tension headaches. You're not doing it on the cheeks, you're doing it on the muscles here, underneath the mandible. Now, Part 4 is to relax the deep muscles of the jaw. Okay, so this muscle is accessible directly in front of your ear and slightly inferior or lower. And what you do is you use your thumbs and put gentle and firm sustained pressure for 5 to 10 seconds and repeat this about 3 times. It should feel tender to the touch. It's kind of like a trigger point. It's an area with a lot of nerve endings. So that intense pressure will help relax the muscles that are deep inside the joint. Let us know if these tips are helping you. This is Doc Martin saying, every day, in every way, you are getting better and better.